Welcome everyone, this is Yasser Wasifi from Learn Dental series. In this episode, I will continue the discussion about how to purchase dental practice and how to set it up from scratch. First of all, I would like to declare that I have no financial disclosure or conflicts of interest with any of the presented material. Also, I would like to notify you that this presentation is copyright protected and could not be transmitted by any means unless you get a prior permission from the author. By the end of this presentation, you are expected to be able to set up a private dental practice from scratch and to find out what being your own boss will be like. Already in the previous episode, we discussed the criteria that ensures that you are now ready to own a practice in terms of 6 questions, and according to their answer, you could identify and point out if you are ready now or not. Now, in this episode, we will discuss how to set up your practice from scratch and what being your own boss. For setting up your practice from scratch, let me first, as an introduction, discuss something with you. Okay, in 1980s, most of dental magazines were full of articles that discussed how to set up your dental practice and prefer to have your own practice from scratch, okay, which is called or termed as cold squat procedure. These articles gave the reader the impression that the starting of your own practice is an easy way and it all was going to be a roaring success. But this is not the truth, because no doubt that some of them were successful, but some of them didn't continue and failed to achieve their goals because they neglect the importance of practice management. They proposed that the only success factor is depending on the dentist himself and his experience in performing perfect dental treatments he already taught in dental schools. But this is not the condition. The condition is the perfection and experience, skills and knowledge in dental treatments and performing dental treatment plans is just only one item of huge other factors or huge other items affecting success. What is the importance if you are a perfect, skilled, talented dentist, but at the same time you don't know how to deal with your people, you don't know how to communicate with patient or with employees. Okay, that's why you should think too much about your management skills when you get for uh, purchasing or for setting up your practice from scratch. You could get your practice by two ways. Either you set up a practice from scratch, a new one, you select everything, or you purchase an already existing dental practice, okay, uh, its owner would like to sell it for a reason or another, okay, but setting up a new practice from scratch provides you with much more advantages. Let us discuss those advantages. Number one, you will have more freedom regarding the location. This is number one. And also, you will have more freedom when it comes to the layout of your practice. More freedom to equip the practice the way you want. Why you pay money for old equipment, okay, that need to be updated? Why you don't get, especially you have the money, okay, and you could afford for this practice, okay, why you pay in old equipment that need to be updated and not get the new one? Especially when you get the new one, you will get also a guarantee, warranty, okay, and free maintenance for at least 1 to 2 years according to the type of your equipment. Also, you are not paying anyone for the goodwill of the old practice, but there are also a number of significant drawbacks that should be considered. You will have to invest a great deal of time, money, and effort to attract your patients because this is a new practice with a new brand name, new location, everything is new. Okay, that's why your income will start at zero and might take months or even years to reach your break even point. Okay, until you get the profit you are aiming to achieve. But please, there are three items that should be considered that will save time to succeed. Number one, location. Number two, location. Number three, also location. Okay? It might be very appealing creating your own practice from nothing, molding it, getting everything just as you want it. You are, however, going to need a great deal of drive, enthusiasm, perseverance, dedication, stamina, vision, and money. All of these should be considered when you set up your practice from scratch. Then, setting up specialist private practice. Most of dentists now, okay, it seems to be like a trend in dental practice, either setting up a specialist clinic that afford only one type of treatment or one type of dental specialty, especially in the field of endodontics or orthodontics. Practice is limited to a definite specialty, okay, or it is a multi-specialty one, okay, which is a private practice with polyclinics. Each clinic is practicing a type or a specialty of dentistry. When setting up a specialty or a specialist private practice where practice is limited to one specialty like endo or ortho, it will be a difficult one when you are promoting yourself. It may take longer time to get patients and to get money. Okay, that's why you could join what is called a group practice. What is meant by group practice? I'm promoting myself to other colleagues, either for general dentists or other specialists to refer their patients to me. Okay, and we have a deal with each other. Okay, one specialist private practice in ortho with one specialist private practice in endo and so on in perio and so on and so on. It is considered as also a polyclinic private practice but in different locations, not at the same property. Okay, but when you decide to set up a private specialist practice operated by dentist, one dentist or many dentists, okay, but all are providing the same specialty or practice limited to only one specialty, you should possess a relevant postgraduate qualifications in their chosen specialism. Number one, not only they are interested in practicing this specialty, no, they should have a postgraduate qualification to convince and to be trustful to patients and to other colleagues, and should have a proven track record of clinical expertise. And you should consider that you will accept most of your patients by referral. That's why, okay, when you decide to set up specialty practice, you will need to build up your source of referrals from colleagues. How could you do this? Number one, writing to all dentists in the area telling them who you are, where your place or where you will be working, what are proposing to do, i.e. accept, that's to say accept referrals, okay, the type of treatment on offer, the terms under which their patients will be treated, okay, how they should refer patients to you. This is number one. Okay. Number two, you could hold an open day or evening when dentists you hope are going to refer patients to you. They could view and inspect all the options, all the facilities in your clinic or in your practice. Impress them with the quality of the facilities. Impress them with the quality of your track of practiced clinical cases. Offer to talk at local dental meetings. Local, not international, because already you are in need for patients or for referral from your local area. That's why you are not in need to offer a talk to international dental meetings. You are promoting yourself as a specialist. Start a study group, either face to face or WhatsApp or by any mean of communication. And write articles in the dental press. Also, it is preferable to be local. Then, when you are deciding now to newly build and set up a practice from scratch, okay, let us go for the procedure. Building your own practice from scratch, it's a long-term plan and one that has a much longer lead in that will call on all of your managerial and project management skills. Going it alone is an option, but you might put together a consortium of like-minded clinicians or investors. Let them help you. Let you get all the advantages of your management skills and their management skills. Always have second opinion. Okay? For now, all you need is to think about the following. When you decide to set up a new build of your practice, one, decide what you want to achieve. This is not simply a new practice. You must be very specific. Consider location, size, number of surgeries, reception areas, offices, demographics, finance, time scales. All of these, you should decide what you want to achieve. Considering these items, think about all of the resources you will have to gather together. Resources not only considering money but also people. Those are, you have money resources and human resources. How to monitor, review, or measure the process and progress. This is the most important one. Most of the practice owners neglect it or deny it, okay, when they are deciding to set up a new build or to set up a new practice from scratch. They then, after they have mistakes, they thought to have they think that they neglect this, okay, but it should be set from the first before starting to set up your practice. How to monitor, review, and measure the progress of your build in relation to your plan, step by step, and take steps to correct things if they wander off course. This is one of the most important. Monitoring that we discussed in the previous episode, this closes the loop of management or this closes the loop of quality control in your practice. Think about what being my boss will be like and be prepared not only to listen to advice but also take it. Let us start about knowledge and background information regarding the boss. Are you willing to be the boss of yourself, or are you willing to hire a practice manager to be the boss? Let us review some things, okay, related to this topic. You should evaluate the knowledge and background information you have. You should think about initial thoughts about recruitment and how to promote yourself and your practice in the early days. Considering the knowledge and background, before you look for practice, do as much research as you can and gain as much knowledge and background information about what running business entails. We have advised you in the previous episode that you should get enough knowledge about what is practice management, especially in density, and you could get much more knowledge either by enrolling in a course or just searching for your knowledge from open online sources. Okay, to get this knowledge, number one, you should talk to practice owners. Study is not enough, but you should get another and second opinion. Talk to practice owner, not only ones who appear successful, but also to ones who have perhaps made an odd mistakes along their way. Talk to both of them, successful and failed one. It is better to learn from other people's mistakes rather than make them yourself. That's why you should talk to them. But remember that people are often shy about revealing their mistakes, but some are willing to share them with others. People who say that they have never made a mistake, be sure that they have probably never done anything. This is the nature. All of us are able to mistake, but not all of us having enough skills and enough courage to correct this mistake. Then find a mentor, a practice monitor to guide you. Talk to colleagues who already practice owners. You should find out about the process of practice purchase, especially the pitfalls and problems. You also want to know something about how they manage their practice. Okay, listen intently to what they say and form your own opinion. And you could evaluate what they do well and what they do bad, and always find why this is good and why this is bad. Speak with your accountant to give you an overall financial view related to your plan, okay? Because they are specialists in this track, and he will drive you to get inside the track in the world of business, especially dental business. And don't forget to find out business planning, okay? That gives you an imaginary picture or view about your practice. Consult your bank if you would like to get any fund from them. Speak to local or regional business organizations. Many countries have business organizations that provide advice to new projects, especially for youth in this country. Okay, and this agency, most probably, you could get free advice and support from them. Forget any ideas that the business of density is unlike or different than other business. Finally, it is a business. All businesses are the same. So, if there is advice out there, especially if it is free, use it. Business of density is like any business. The greatest source of learning is going to be the practice itself in which you are currently working. The practices that deliver the best patient care are the ones that are very well managed. Therefore, if you are fortunate enough to work in a very well managed practice, find out how they do it. Even if you are unlucky and you work in a very badly managed practice, work out why they are getting it wrong and what you would be differently to put things right when you are a practice owner or when you are setting up your own practice. Most of practices lie somewhere in the middle, and so you will always be able to find examples of good and bad management in your current practice. While you are observing the management of your current practice, try to find always the answer of why things are done good and why things are done bad. That's why I advised most of recently graduated dentists, don't hurry to set up your practice. Please try first to join any existing practice to get enough knowledge about the management. Focus on how they manage and how they run this practice, why things are going well and why things are going bad. Don't start to set up your practice and you don't have any experience. Clinical experience is easy to you as being a dentist, as being recently graduated, as being young enough, okay, to be to be trained or to be gained. It's not too difficult to get it, but focus on management when you are joining these practices. Especially at this time, you don't have any risk and still you are young and maybe you don't have any family responsibilities. That's why I advised you to postpone your decision of having new practice or setting up your own practice until at least you get experience from other existing practice. Having read books about management and dental practice management, you should now be in a position to not only judge the start of what is being done, but also to recognize what is not being done. Again, find out why, because finding out why is the key to successful innovation. Then coming initial thoughts about recruitment. You should give some thought to how you are going to recruit employees and clinicians. Okay? How many you are going to need, and the personal qualities, qualifications, and experiences also you are looking for and suitable for your type of practice. As a rule of thumb, employ people with the best qualifications and most experience, and you can find and can afford for them for their salaries. Try to only employ those who are committed to provide excellent patient care and service. Patient care can be taught. It is the employee's attitude and personality, and that is the key. It is not that they are having an experience or educational experience in dealing with patient care, but also their attitude in applying it. Third, don't overemploy. Employ more people than you need in case only someone might be off sick. If you need for 5 people for different jobs, okay, you could employ 6 or 7, okay, but you are not in need to employ 10 or 15, okay. What's the records you are in need to review when you are recruiting people? Number one, sickness record, and determine what level of sickness is acceptable and it is repeatable or not repeatable in order to not affecting the smooth flow or the smooth running of your business. The disciplinary records. Is your patient, is your employee is a troublemaker or not? How many he get a disciplinary warning? Then comes qualifications that signifies commitment, training, both the previous and the planned one. It gives you an idea how much this person is interested for his self-development that will be reflected in the development of your practice. How to promote yourself, especially in your early days. You should have a marketing campaign or an idea about a marketing campaign, okay, as soon as you have ownership. It could have started before that if you were 100% certain of the date you will start. There is a lot of ways of marketing of your practice. It started by those are good ideas for your promoting campaigns or marketing campaigns. Number one, and the best one, is recruiting employees from the local area where your practice are in. This can help you to spread in your local area, making yourself known to local business. Visit them and leave your business cards. Okay, encourage your friends to talk about you and your practice on social networking and social media. Create your own blog and talk about the trials and tribulations of owning practice. Contact local newspaper, okay, and get them to write features about you. But don't waste money on flyers or adverts in newspapers. Takeaways and business desperate for customers do that, but not successful in dental practice. Let me show you some of amazing promotions and marketing campaigns for dental practice. This is one. This one is very interesting. Banana is always yellow. Egg yolk is yellow. Also, lemon is either green or yellow. But hardly you could see what had been written down in each picture, but it attracts your eye. What is this white banana? What is this white egg yolk? What is this white lemon? Then you could come closer and focus in. Okay, you will find that they write, we don't like yellow. We don't like yellow. That means that this practice is interested in aesthetic. It provides aesthetic treatments. Okay, and underneath is their website. This is an amazing, attractive marketing campaign that denotes how much they are interested in aesthetic restorations and aesthetic treatments. They didn't say that we are providing bleaching, we are providing laminates, we are providing blah 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 blah. No, we don't like yellow. That's it. Another one who used the most commonly, routinely used promotion for treating treating bad periodontal conditions or treating gingival illness, okay, or gingival diseases is eating apple, and it comes in TV promotions that the patient, when biting the apple, he is suffering from pain or he is suffering from bleeding of gingival tissues. Okay, this is another promotion where the practice decided to use the same apple, which is printed in the brain of people, that eating apple discovers all the problems in teeth or eliminates the problems in teeth. Okay, that's why he recarved and reshaped the apple using any graphic software. Okay, made it in a form of molar, having been bited by a big bite, and the tooth prints, the tooth marks are obvious without bleeding, without anything. A huge bite is drawn, and he just write downward, feel the taste of power. That's it. Very simple and very descriptive. Either this taste of power is due to stronger restorations, is due to periodontal treatments, whatever, but it's very descriptive. It is the opposite of the printed mental image, okay, for all populations. That is the most commonly used photograph for TV promotions for either toothpaste, dental treatments, importance of perio treatment. Okay, he uses this. Okay, another one interesting in aesthetic, okay, is lighting up the room with your smile. That's it. He's promoting for bleaching, okay, of teeth. He's promoting for aesthetic one. But recently, 1 month ago, I discovered one of the best ever I had seen with maximum search engine optimization. When anyone would like to search for a dental practice, okay, for the first time, he will Google it and write the following: dentist near me, okay, and he will select Okay, one of the available proposed dental treatments. That's why this practice use this terminology exactly to be the title or the name of their practice. Dentist near me. Just it is the same as written when patients trying to Google it. Okay, they already has this innovative idea. Okay, by searching and by asking, by surveying the patients, what are you doing when you are in need for a dentist for the first time? Most of them recently answered that I Google it. How did you Google it? I just write dentist near me. Okay. Most of the surveys answers, okay, write down this statement, dentist near me. Then he gets his priority and titled his practice by the same name. Once you Google it, dentist near me, it will be the first one to be proposed by Google. It's an intelligent idea. Again, take a home message. Ask, measure, learn before you decide to be a practice owner or to be a practice manager or to purchase your practice. Ask the right questions for yourself and for others. Measure the right data. Evaluate your data, what's wrong and why, and what is right and why. Okay, even if it is not a big data, but you should measure your data. Take actions and learn from them. Because another home message, success is not only to set up a practice. Okay, no, it's hard work. You need to improve, you need to focus, you need to have passion, you need to push yourself, serve, get ideas, persist, and the cycle is continued. That's why what we discussed about our comfort zone and how we get out of it to increase your comfort zone. Then you repeat the cycle again until this cycle is every now and then when you achieve your goals, okay, it starts to be bigger, bigger, bigger and drives you to the next set of goals to be achieved. This is success. It's a continuation procedure, not only for once. Finally, those are the textbooks I used in preparing this presentation. Feel free to ask me as your questions are welcomed 24/7. You could ask your question by commenting to this video, please, and I will reply to you as soon as possible. Please don't forget to like this video, subscribe to my channel, activate the notification to get all the updates every now and then. Finally, I would like to thank you for assigning this time to listen to me. Until we meet again, Yasser Al-Wasifi. Thank you.